Question 23, which of the following describes the correct HVLA thrust direction to treat this dysfunction? And we got fibular head, lateral mal, tibia. Okay, so it's probably a fibular head question, something to do with the tibia, whatever. A 23-year-old woman presents with lateral knee pain. Okay, so definitely, probably, maybe, possibly fibular head, following an inversion ankle injury. Inversion ankle injury. On exam, the lateral mal moves anteriorly with plantar flexion, but fails to move posteriorly with dorsiflexion. Okay, so you can like memorize the inversion, eversion stuff. I never bothered doing that. I always found that the anterior and posterior movements was good enough to get through just about every question I've ever seen on fibular head. However, they didn't give us fibular head movements. They gave us lateral mal movements. Cool OMM logic is that the opposite sides of levers tend to move in opposite directions. So if I had a stick like this and I was going to take the bottom end and move it that way, and let's say the top end was fixed in place, well then relatively speaking, it would then look something like this, where now this bottom end is farther forward or farther anterior than the top end, which is more relatively posterior. Same thing applies to the ankle and fibular head, right? So if this is our lateral mal, this is our foot, and the tibia here, excuse me, our fibula, I should say, the lateral mal, and then fibular head up here, and then foot down here. We are moving, the lateral mal moves anterior, but fails to move posterior. Okay, so let's just do one at a time. If the lateral mal is moving anteriorly, then our lever logic says that the fibular head should move posteriorly. Okay, and that would look something like this. If this was the starting position, the lateral mal moved anteriorly, the fibular head moved posteriorly. But we can't do that here. Right? So our problem is it moves anteriorly. So it does this part just fine. The lateral mal fails to move posteriorly with dorsiflexion. So it cannot go backwards, which means that our fibular head cannot move anteriorly. So if our fibular head is stuck posteriorly, can't move anteriorly, then we, with our big, strong OMM hands, need to come in and push it anteriorly. That simple. So we need a posterior to anterior force to get it to move anteriorly. So just looking at our answer choices, that would be B, a posterior to anterior force at the fibular head for our HVLA thrust. Correct answer is B.